The Central moves the region from a moderately performing region to a high-performing region. Director Dr. Kosia Sapong says the region has seen a reduction in maternal and childhood mortalities as well as teenage pregnancies, and more efforts are being engineered to better the health outcomes. Speaking at the Central Region Health Performance Review in Cape Coast, Dr. Sapong underscored the need for critical supervision and more stakeholder engagement for a more improved outcome. Richard Kojanyako has more.
According to the Regional Health Directorate, through the collective engagement with their key stakeholders, the Regional Health Service launched a 3-year initiative to address the recurrent challenges with maternals or maternal deaths through the adoption of the maternal death tracker, the building of the capacity of their staff on safe motherhood and life-saving skills, supervision of maternal health services by their specialists in all various areas, and community engagement on maternal and child health. She spoke on how the initiative has helped in reducing maternal and child mortality as well as teenage pregnancies.
Through these efforts, we have improved in most of our indicators, and therefore our aggregate score, holistic assessment score, as will be presented today by Volta Region, improved from 3.6 in 2020 to 4.1 in 2021, making our region a high-performing region. We additionally improve in areas of childhood immunization, family planning services, and HIV services, among others. This initiative has proven to be very effective so far and has led to reduction of maternal deaths, with maternal mortality ratio reducing from 109.2 from 13.3% to 12.7%. Closely related to the maternal mortality challenge, and indeed a potential factor that can easily trigger maternal deaths, is the issue of teenage pregnancy, which is a challenge in our region. I'm happy to say that we improved slightly in reducing teenage pregnancy from 11.8% to 11.6%, but we need to do more.
The Regional Health Director also spoke about the new policy of network of practice that is helping to improve the health outcomes.
In recent times, the health sector has adopted the policy known as network of practice, where there is a well-equipped model health center which is linked to workplace infirmaries, marketplace infirmaries, school infirmaries, maternity homes, chemical shops, and chips compounds for ease of referrals at the community level to support achievement of various districts to implement this policy. And I'm happy to note that many of them have responded positively by taking steps to designate some of their facilities in their districts as model health centers and making the necessary efforts to support them to function as such.
Chief Executive Officer of the Cape Coast Teaching Hospital, Dr. Eric Kofinjedu, addressed the issues of referrals in order to reduce mortalities in the health facilities.
Statistics, it is my hope that all health institutions in the region, be it private or public, will help reduce avoidable deaths by complying fully with the National Referral Policy and guidelines.
Central Regional Minister Justina Marigodasan commended the Ghana Health Service for the remarkable strides it's making and assured them of government support in the area of personnel and infrastructure. On COVID-19, so far, the cumulative number of cases recorded in the region is well over 553 doses of COVID-19 vaccines out of the eligible population of 1,692,345. Those receiving first doses of COVID-19 vaccines is 785,603, and people who are fully immunized with the 2 doses stand at 455,806. Reporting for JoyNews, Richard Kojanyako, Cape Coast.